Hi, this is Paul Feuerstein. I'm the technology editor of Dentistry Today, and I'm here today with Sean Boynes. Sean, how you doing?
Good, how are you?
We're here talking about Septodont's products, a few interesting things that they have going on. And right before the interview, I said, I'm going to trim my hair a little bit so I'd look better on camera, and I said, oh, this will be okay. We're both musicians, and this is going to be a lot of fun. So rather than talking about music, though, we're really here to talk about things like OraVerse. So tell me a little bit about OraVerse itself.
Okay, so OraVerse is a local anesthetic reversal agent. It actually works by reversing the effects of the local anesthetic that we administer to every patient to decrease the pain response they have during any procedure. And the way it works is it contains phentolamine mesylate, which is an alpha blocker, thus making the vessel dilate open, allowing more clearance after the patient has had the procedure completed.
So most of the local anesthetics have epinephrine in them.
Correct.
It constricts the blood vessels to maintain the anesthesia, so you're reversing the epinephrine, actually.
Correct.
I see. I never understood how that worked.
Well, there you go.
And does it work 1-to-1 or 2-to-1? Or
Right, so the basic use is if you've given one whole cartridge of your local anesthetic, you would then take that local anesthetic cartridge out. You can use a new needle. You can do 2 injections with the needle. You put in your OraVerse, and you do another 1-to-1 injection. And you can do that to a max of 2 OraVerse cartridges. That's the maximum allowable dose.
Now, is there an age limit, upper or lower on this?
So it's only approved for those that are older than 6 and weigh more than 33 pounds.
But if you have 6 to 12-year-olds coming into the practice, and typically they bite their lips, they bite their tongues, so I'd assume there's a positive for using the OraVerse.
Correct. A study that we actually completed out of my organization looked at school-age kids in a school-based delivery care system. Mm-hmm. And what we found was that it did decrease the complication rates from 5.3 to 2.6 in the group that actually used phentolamine mesylate. And the audiences that we found worked the most for were those with ADHD and those that are overweight and obese, because that population actually tends to have more self-inflicted soft tissue injury, while also having the more severe types. There are reports and literature where you can see a child that has amputated their complete lower lip.
I think we've all seen that as we practice. You get a call from the parent, go, what did you do to my kid? The kid's ripped off, and they bite my tongue, and they're bleeding, and this, that, and the other thing. So this sounds now. How does this work instantaneously, or is there a time frame on this?
No, so it reduces the effect of soft tissue anesthesia, and it does that usually by about 50% in my practice.
Okay.
But normally, I think there was about 51% or more that went to complete normal function within an hour in the pivotal trials.
That would be great for if I had a patient that had to come in, and then they said, I have to give a lecture at 4:00 today.
Correct.
They'd be back in business. That's really good. This company has a lot of products. I mean, they have all the local anesthetics. I understand there's some sort of a guarantee or warranty of some sort with this?
So Septodont, as far as I know, is the only organization that offers a 100% satisfaction guarantee. So if you're unhappy with the product, if you miss a block, if you were just of the opinion that this is not a good agent, they'll completely replace whatever it was you were unhappy with.
So they call that, I think, the seal of satisfaction?
Seal of satisfaction.
I like names like that.
Yes, it does pop.
One of the other things I've actually used and been looking at is something called Bio-dentin, or Bio-dentin, and it seems to be what calcium hydroxide was supposed to be. And you can do this for pulp capping and for indirect pulp capping. And just before the meeting, I got an article from the Journal of Endodontics that was written a couple of months ago, and it said that this actually works. They validated it, and some of the other products that they looked at did not work. So I think that's pretty interesting. Have you seen this used in your practice?
Yeah, we use it in our practice, and the way that we see it working, at least within our practice, is the same way you described. It's really helped us with pulp capping and eliminating the need for any type of root canal treatment in the patients who, with me being in a public health format, that's very beneficial because most of my patients won't have the opportunity for that root canal treatment.
Come back. Boy, that's something else. I have to say, Septodont is quite a company. People just think of it as just they have Septocaine or something like that. There's a lot of information out here. If there's more information that the dentists want about the company or about the products or about OraVerse particularly, where would they go?
Well, they can always consult the local rep, and if that doesn't work out, you can always go to septodontusa.com or OraVerse.
Oh, there's actually OraVerse.com.
There is OraVerse.com.
Perfect. All right, that'll be great because I think there's a lot of misconceptions about the product, so that's going to be great. Well, this has been wonderful.
Thanks.
It's really been a pleasure to meet you too,
Yes,
and we'll have to talk about the Gibsons later on.
Yes, we will.